you're good to go.
So today we're here to talk about long COVID, and it seems to me that there is quite a high number of people who are either experiencing long COVID or they are experiencing, say, damage from vaccines that symptoms are quite synonymous with long COVID. And I think it's pretty obvious why the two are very, very similar. The good news is that whether you feel like you've had some sort of reaction to vaccines or whether you feel you have long COVID, that the treatment is relatively similar. There is also a danger of suspecting everything that you could have could either be some form of acute COVID, or any group of symptoms could be long COVID, given the sort of environment we're living in at the moment. But if you're pretty sure that your symptoms came on some time after having COVID and they've remained, so for example, if you look at the surveys and the studies that have been done, the biggest remaining symptom has been fatigue overall with long COVID. When you look at the studies, after fatigue, it's been things like breathlessness, brain fog, and also after that, there's been anxiety and dysautonomia. Now, dysautonomia is a form of autonomic nerve dysfunction. Things like POTS or palpitations or heart racing could be another symptom. It seems that the treatment for acute COVID is also quite useful for the treatment of long COVID and for those who've had adverse reactions to the vaccine. So, for example, people using quercetin at high doses for long term, vitamin D, using zinc, also using ivermectin, which is a medication that had been used historically for treating worm-type infections in populations. Ivermectin is a very safe drug. It's had nearly 2 billion doses used worldwide now, with very little reactions. If you want to look at the protocols for using ivermectin, there's a UK group set up by a group of doctors called BIRD, B-I-R-D, which I think stands for the British Ivermectin Research Doctors Association or something like that. Ivermectin can be most easily obtained from alldaychemist.com or possibly from a friendly GP. In terms of treatment for the symptoms of long COVID, again, another issue I'm finding with patients is that, again, whether it's from the vaccine itself or whether it's from an effect on the immune system from having COVID, we're finding that those patients of autoimmune disease are finding a reactivation of autoimmune symptoms that they had previously, or an exacerbation of symptoms that they've had historically. Some patients are reporting having worse, say, rheumatoid arthritis symptoms now than they've ever had previously before having COVID. And again, we've had patients in clinic who've had the vaccine as well, and again have had reactivation of autoimmune symptoms. In those patients, again, you're looking at addressing underlying causes. We're working with the immune system, trying to improve, say, natural killer cells. Also, herbal medicine can be very, very useful as well. Again, using herbal medicines that are specific to the symptoms that the patient is experiencing, whether it's fatigue or whether that's heart palpitations or lack of sleep. Examples can be herbs like Praeria lobata, Chinese sage, so when there's inflammation happening, Siberian ginseng. Again, the list is quite endless, but again, for a good resource on long COVID and herbal medicine, people can look at Stephen Booner's protocols online. That's Buhner. Also finding for patients that treatments such as infrared sauna for the issues around if people having breathlessness or breathing issues, so using infrared sauna can be very useful for improving endothelial dysfunction. From our partner at Get Fit, you can get it's like a little dome that goes over the chest area, and that's very, very powerful at treating particular areas like the lungs. So if people are finding breathlessness or issues going upstairs, we have seen good reports of patients really helping improve those problems quite dramatically. Also finding frequency-specific microcurrent. There are specific protocols with FSM that are very useful for long COVID. There is a really good virus program. There is a nervous system hypoxia program, And there's a fatigue program as well, which seems to be getting good traction with people practicing FSM. Also, what we're finding is because of the anxiety that people have been experiencing during these times, that's feeding into old anxieties that people have experienced historically. And as such, those are much more coming to the fore now. So there is an anxiety, mental and emotional component, like many conditions linked with long COVID. And I think patients addressing or using tools to address the mental and emotional and psychological aspects of illness would do very well with long COVID. And there's lots of modalities open to patients, things such as family constellation therapy, EFT, emotional freedom technique, TRE, which is trauma release exercising, doing more sort of like Jungian psychology analysis or therapy, somatic body work, embodiment practice, whether that's through dancing such as 5 rhythms or movement medicine. So there's a lot of options. Again, chanting can be a very, very useful, powerful method of getting people out of their heads and into their body, and singing, devotional singing of all types can be very, very useful. So, as I say, we are seeing, I think colleagues are seeing in the States, for a lot of the boards and forums I'm a member of, are seeing increasingly very large numbers of people coming into clinic with either long COVID or adverse vaccine effects. As I say, but the good news is that both can be treated in a very similar way, and we are seeing very good results of patients using some of the methods that I've just mentioned earlier. And I hope this video is useful for everyone. Thank you.